most of the restrictions eliminated, we dare to think that we can talk about the post-COVID stage. The virus and the crisis it brought changed many things, including the insurance market. Clients got used to online services, and consultancy is now more important than ever. Priorities changed, meaning that health and life insurance products are put in a better light, and so did the relationship insurer-broker-client. Mr. Zahal Levy, president of MediHelp International, is here to tell us how important the role of the insurance brokers becomes in the context of all mentioned changes. Mr. Levy, how do you see the role of the insurance broker in the post-COVID stage?
Thank you, Anna, for the question. If I have to summarize everything I have in my mind into one phrase, it's social responsibility. The changes in the market and the changes in our world since the crisis began implies that we have to be much more careful when we meet the broker, be more responsible about the consultancy we give him, make sure that we lead him to the right decision, while maybe reducing or even eliminating our own interests. We know very well that there are some brokers who have gotten addicted to sign the documents with the customer mostly in a technical way, and that the consultancy item and the advisory item within the relationship has decreased with the years into some kind of an automated pilot. We are now in a new situation, and the broker has to study the changes in the health insurance market, the changes in the health system, to understand better what is happening in the country and what is the changes in the accessibility of his customer to get medical attention when he needs it. It is thanks to the insurance broker that using the right insurance tools, his customer, your customer, the broker, can travel anywhere in Europe to get medical care if he fails to receive it in his own country. And in his own country, he can choose to address any medical care in any clinic, any hospital, any doctor, or any type of investigation of his choice. He does not have to be restricted to one provider or one address. And we shall pay, the insurance company that specializes in health insurance will pay all the expenses that are relevant to such an event. And that, I think, is very important, because sometimes we forget that to sell an insurance policy on an automatic pilot type of thing, that sign here, here, and here, and then we make our commission, and then we forget that the expensive car that was just insured is much less expensive and much less valuable than your customer's health. And in the situation that the healthcare is changing so rapidly, the broker must take his new position in a leadership way, study the situation of the healthcare market, study the healthcare solution in the insurance industry, and become an advisor and a leader in the society in order to guide the customers to do the right thing.
Mr. Levy, thank you very much for all this information regarding the importance of the role of the broker in the post-COVID stage.
Thank you very much.